morning, Tiffany.
Good morning, Christina.
I am getting your patient in room 3 here.
Okay.
Are you ready for a report?
Yeah, let's go to the bedside for the report.
Perfect.
Knock, knock. Good morning, Marcy. Hi, I have Christina. She's going to be your day shift nurse. Good morning.
Good morning.
So we are going to do that bedside shift report that we talked about at the beginning of our shift. Okay, Darcy here. Her illness severity is stable. Patient summary: she is not a DNP. Her spouse is Dan. She was 41 weeks and 3 days. She's a G4, P3, so that just is how many pregnancies you've had and how many babies you've had. She delivered this morning at 3 o'clock. It was a vaginal delivery with a first-degree tear with no repair. We had a little extra bleeding. Her QBL, so that's how much blood, the quantitative blood we measured, was 1,646 milliliters. She got her epidural around midnight, and it was absolutely wonderful. It helped her so much. Her blood type is O positive. She was a high hemorrhage risk, so she did get 2 IVs. The GBS status was negative, Hep B is negative, and rubella anemia. When you go to check her fundus, it is firm, midline, 1 below, so that's just where your uterus is sitting, and you want it to be nice and firm and not too high up in your tummy, so that you're not bleeding too much. There were no clots on her last rub. She was able to get up after delivery and was able to void with no difficulty. She currently has 2 IVs. She has one on her right forearm that is sending out, and then she has a second one on her left wrist that is infusing her second bag of Pitocin.
Just going to take a peek at that while we're talking. Beautiful. If you have any pain or discomfort or aching around that IV during your stay, just let us know.
In the last 24 hours, she's had 2,000 milliliters in and 1,600 out. She's had, so that's just how much fluids you've taken in and how much you've get out for us. No abnormal assessments, and there's no pertinent past medical history, no social issues either. For her action list, she does have scheduled meds. She has Colace 100 milligrams oral BID that is scheduled for 9 o'clock, and then she is to continue her Pitocin and just finish out this last bag.
Okay.
For pain medications, she has ibuprofen every 6 hours and Tylenol every 6 hours. She last got ibuprofen at 6 a.m. And how's your pain doing now? Okay, what would you rate that? 8. And she has not had Tylenol yet.
Okay.
She does not need any immunizations prior to discharge. She is not a candidate for ROGAM. ROGAM is just another shot that they give you if your blood type is negative. She does want a postpartum tubal, so we went to NPO, so nothing by mouth, can't eat or drink anything, at 6. And that will be scheduled for later this afternoon. Yes. And then she is scheduled to have some labs done. The doctor just wants to double check your lab work and make sure everything looks good after having all that blood bleeding from earlier. So they should be around here soon to do that. For situational awareness and contingency planning, she is still currently a fall risk, just because of the having that epidural earlier.
On the IV still. That just means that we want you to call us for help to get up to the bathroom until we tell you otherwise, okay?
She continues to be a high postpartum hemorrhage risk because of her hemorrhage that she had. She's not on isolation. She signed her safety plan. That was the form that we talked about earlier, the maternal child She does plan on breastfeeding, and she does not have any discharge needs at this time. Her primary provider is Full Circle. She'll probably need social work follow-up just because little Dawson is over in the NICU.
Okay.
And then we'll review her MAR. Here is her scheduled medications.
Okay.
I have completed her care plan for labor. I've started your postpartum education.
Okay.
And here are our orders. I've released all orders.
Okay.
All right, Darcy, do you have anything to add?
Okay. So I'm just going to review real quick that you had a spontaneous vaginal delivery with a pretty good blood loss after. So we want to make sure that you're safe. You can call us for any activity out of bed, so if you need to go to the bathroom or anything, we'll help manage your IV and make sure that you're not lightheaded or dizzy after that blood loss. We're also going to stay on top of your pain. You last had your ibuprofen at 6 o'clock this morning, so your next dose will be at noon. And then you haven't had any Tylenol, so if you need something in addition to the ibuprofen, we can give you Tylenol at any time. Just a reminder that nothing in my mouth, so don't eat or drink anything because we want your stomach to be empty for the tubal ligation that's planned for this afternoon. Okay? Do you have any wishes or goals that you would like to address today?
I'd like to keep pumping and then shower something.
Okay. All right. We'll put that on the whiteboard and make sure that those things happen today. Okay. Alma's my helper today, and she'll help me with those things. And we will get report on the rest of my patients, so I'll be back to do your assessment.
Congratulations, Darcy.
Thank you.
You're welcome.
What was your name again?
Christina. Alma is my helper today, and she may be answering your light at some point. Okay. Let's see. Pain meds plan. Ibuprofen is available at 10:30, and Tylenol is available anytime. Just call and ask for that. Okay. And then also see baby and pump. How about a shower? Have you had a shower yet?
No, I'd like to do that today.
Okay. Well, as soon as your IV is done, we'll cover the saline locks and get you in the shower. Okay. If you have any other goals that you think of during the day, just let me know. We'll get them up here so everybody's on the same page, okay?
Great.
Perfect.